I made it to the hospital. Yes, this is it. Anyway, so I'm here at Overlook. I'm having I think it's the name right here. I'm having a right suboccipital craniotomy with a stereotactic dissection of the cerebral tumor. And my tumor is 2.1 centimeters by 1.8 centimeters. And originally, this swelling around it was 4.3 centimeters by 5.8 centimeters. So, anyway, see you guys when I'm done. The surgery went well. It actually went better than I thought it would. I was expecting much more pain and discomfort. The doctors and nurses were on point. Whenever I felt pain, they gave me the proper meds. That night, I had to have cognitive testing done every hour, so I didn't get much sleep. I thought that I would be annoyed, but I really wasn't. The following day, I didn't feel much pain, but was unable to walk on my own and felt like my brain wasn't fully able to communicate with the rest of my body. They came and walked me a few times, but my balance was way off. By the third day, I was ready to go home and requested it. I felt that my mom could do the same things at home that they were doing at the hospital, and guess what? I was released. A few days later, my mom and I celebrated my 50th birthday. I originally was making plans for this big party, but I'm happy that I changed my mind. It would have been a disaster with everything else going on. About 2 to 3 weeks later, I started physical therapy, had some scans done, and also went to see the radiology oncologist, Dr. Emilo.
It's just alcohol.
Oh, okay.
Just a little cold, probably.
Alright, guys, so I am at the doctor's office and I'm having my staples removed. That's Natalie.
Hi.
I'm hoping it doesn't hurt. She said it's going to be just a pinch. So.
Everybody always says it doesn't hurt. So I hope that's the case. Have you ever had staples out before? Ever had staples?
I think I've had staples, but I can't remember. Yeah, I did have staples, but I can't remember.
The probably the weirdest feeling is that someone's touching.
Ooh, no, that's not the weirdest feeling.
Okay.
Whew.
Sorry. I'm probably taking those little hairs with me too. That probably is what you're feeling too. How you doing?
Oh boy, I'm okay. How many we have? It's 422 or 24 or something. Oh god.
I don't know. I didn't count. Let's see. I took out 3.
Oh,
I'm sorry.
boy.
4. Some people take the staples with them. I can always take a break too.
Nope, let's just get it done.
Do you want to lean your head forward a little bit? It looks great.
Oh, that's good.
If that helps at all. Then you'll be able to use, are you washing it under also?
I've been using the shampoo that they gave me at the hospital.
Okay.
Ooh wee.
That one wasn't fun? I'm sorry.
Oh, God.
Sorry. That one didn't want to come out with me. Want to take a little tiny second?
No.
No? Okay. You just push through.
Yep.
You're all done.
Oh, thank you.
You're done.
Let me see what they look like.
They're little, they actually look like little staples.
Oh, wow. Hey everyone. So right now I am in the office in the radiology office, radiology oncology, and today we're here for a consult to discuss cyberknife. And so, although they took, although they took the tumor out, they want to do cyberknife in that area to get any, I guess, free little radical cancer cells floating around.
So left and right are reverse. So the L here is for the left side. The back of your head is here. These are your eyes, your nose, your ears. And we're slicing through as if you were a loaf of bread. They give you dye or contrast intravenously, and that's going to spill out into any abnormal areas. And so you're seeing the brain is like a walnut, and the halves should be identical on both sides, right? So we're looking for things that are maybe happening on one side and not so on the other. When we start at the very top of your head, there is another area besides the one that you had the surgery on. I don't know if anybody pointed that out. There's a little tiny one right here.
Oh no, nobody told me that.
Okay, there's a little tiny white circle right there. Okay, that's not causing any trouble just yet. There's really no swelling around it. It's kind of like the brain's not aware that that's there. Okay, but there is a little one.
Wow. See, no one said that to me.
Everything here otherwise is normal, right? So you're seeing some contrast, but those are the blood vessels. All of that we're expecting to see. As we get back to the back part of your brain here, okay, what we call the cerebellum, this is your balance, nausea, vomiting center. Okay, so there you have that. That's where the vomiting and all that was coming in, the dizziness. This should be an open circle, and it's being kind of compressed over this way because this area here, this white circle, does not belong. And there's a big kind of patch of gray surrounding that. Right. So the fancy term for that is edema. That's swelling in the brain. That's because the brain is a very protected part of the body. It knows that there should not be breast cells there, and your immune system is coming at this. And a lot of times the symptoms come from that pressure, from that compression.
Yeah, because once they put me on the
steroids,
headaches just went away.
Because you start beating back some of that swelling.
Yeah.
Okay. Yes.
Is that a X-ray or whatever?
MRI.
MRI of her when she had
before the surgery. Yes, preoperatively.
But the small one is still there.
The small one is still there.
Okay.
Yes. So now you haven't had an MRI since the surgery. They just did a CAT scan without contrast. So just to rewind a little bit, sometimes we will treat these without surgery. Okay, like that little tiny one does not need to come out. This would be too dangerous to come in with high dose radiation treatment to, because what the radiation would do would be kill this off and then create more swelling.
Right.
And then swelling in the back part here can be traumatic. Okay, we can have issues with what we call hydrocephalus, or where we block off the flow of the cerebral spinal fluid. It would be an emergent surgery. Okay, and we don't want to do that. And you're young, and we want to keep you functional, right? That's the whole goal of all this. So when I saw this, the first thing I said was to call Dr. Frizzola to get this has to come out.
Right.
Make some space.
So the little one that you said we don't
Yes.
have to.
We don't have to operate on that. No.
So are we going to hit that?
We are.
Okay.
Yep.
Okay.
So now, after you can, this is the CAT scan post-operatively. They do this to make sure there's no bleeding or anything, dramatic happening in there. Okay, but it doesn't. Obviously, you don't see the detail here that you see on the MRI scan.
Right.
What happens is that now we know that this area is out, and we know that we want to kind of treat the perimeter of this, and we want to treat the other little area that did not come out. Okay. What happens with the brain that's different than, let's say, the breast, for example, is that when you have surgery on the breast, the surgeon doesn't just go in and core out the abnormal area. They take a rind or a margin around the outside. But you can't do that in the brain. You can't take all this extra brain tissue just in case, okay? Because all the brain is performing vital function. So he's taking out what's absolutely abnormal, but it gives you about a 30 to 50% chance that something could recur, come back along the perimeter of where that came out.
Right.
So we follow up with radiation treatment to those edges to reduce the risk of something coming back to single digits, okay? Not less than 5%. The other little area we could treat in one visit and probably eradicate completely with the radiation treatment alone.
And for the bigger area, how many visits do you do?
I'm gonna say one. We will get another MRI because now this surgical hole, the cavity, should collapse or get smaller, which will make my target smaller.
Right.
And the swelling surrounding it should also be going away. So I'm hoping to see a lot less swelling, nice clean cavity, and a small area to go after. If the target is little, there's no reason to drag you back and forth for more than just one treatment to that spot. Okay. So I would say bank on 2 days back to back.
Okay, and how long does the treatment usually
About
last?
20 minutes.
Okay,
Okay, so I'm going to say factor a half an hour total for each visit. We will go through a planning session, so we will bring you back for an MRI and a face mask. We do same day back-to-back appointments. So the MRI will give us a real-time picture of what's happening in here now. We'll make this for you. I know when you had the breast treatment, you were laying on your back probably with your arms up and they made something for you to lay into.
Right.
That was to help get you into the same position each time. This is the same thing with the mask, but this also prevents movement during the course of the treatment.
Okay.
You can breathe through it, you can see through it, it's flexible, it's not entirely uncomfortable, okay? You can talk to us through it if need be. This, they'll make one that will shape to your face, locks down on the table, and this way we don't have any of that kind of movement going on, okay? We'll do the MRI and the face mask making on the same day back to back. Usually you come back the following week for the treatments, and like I'm saying, we'll plan for two days back to back. Worst case scenario would be we add an additional day on there if this cavity still looks very big or if there's still some swelling lingering, but I don't think so.
Okay. So after the surgery that I just had, so my legs are really weak. I'm going to physical therapy for that, and I still have the dizziness.
Yes.
How long does it usually take for that to go away?
It can take a while. It can take months to recuperate from the surgery period. It's all an injury to the brain. And sometimes things don't recuperate back to the way they were before all of it. To use an extreme example, if somebody has a stroke and they have paralysis, they can recover some motor, some strength, but they never get back to the way they were before the injury occurred, before the stroke happened. And there can be something similar to that. So you may always feel like the balance is a little bit off, but I imagine it's just that you're still recovering. There's still some swelling, maybe lingering. It's only been about a month now anyway, and maybe you just need more time. The physical therapy is good. I think that'll help to kind of get you on your feet, make you a little bit stronger. Maybe they can work on capitalizing on the parts of you that are still functioning a little bit better to try to make up for the imbalance issues. Yeah.
Okay. So
Are you still having nausea or headaches?
So my headaches aren't bad like they were. But, like when I wake up in the morning, I might have a slight, I'm still taking a Tylenol.
Okay. A lot of times the morning headaches are because you're laying flat. Intracranial pressure increases when you're laying flat. When you sit up, get moving, believe it or not, gravity helps to reduce that. So sometimes just getting up and getting moving will help with the headaches a little bit. But it's not uncommon to wake up with one. Plus your surgical site is back here. That's kind of a tough spot. A lot of people I find have discomfort around where the surgical site was done as an ongoing thing afterward. Yeah.
What's the best way for her to sleep?
No, I mean you can.
There's no. Okay.
I don't think there's any need to have yourself propped up or uncomfortable. Just be as comfortable as you can, and just know that sometimes it's just going to take sitting up, get moving a little bit, put a little food in your stomach, see how you do. You're entitled to still take a Tylenol in the morning if you feel like you need that, but sometimes it's just a matter of helping things kind of.
And that radiation, is that the CyberKnife you're
Yes,
talking
yeah.
about?
CyberKnife is the name of the machine. It's still radiation treatment, but what it is very targeted or pinpoint radiation treatment that we're using to just really hone in on those two problem sites. So that should reduce the exposure to the normal brain tissue.
Will it cause any burning to my
Skin? No.
Okay.
Yeah.
Great.
And honestly, it won't cause any hair loss or anything like that either. The only times that we see that is if the targets are very close to the scalp or to the skin. The one that you have in the cerebellum is not. This one up here is not either. It seems like there's a fair amount of skull underneath there to protect it. Yeah. So maybe a little bit of headache from the positioning with the mask on. Some people can have a headache that evening. Again, with these surgical sites in the back, you're never on a pillow. You're on a plastic headrest. It could feel a little more sore to you.
Because this is really still sore.
Yeah. You could certainly take some Tylenol for that. That's not going to hurt anything. People will tell me that they feel a little more tired or fatigued for about a week or two after this type of treatment. Should not be anything crippling or tremendous change from how you're feeling now. I'm sure you're still pretty fatigued even from this whole months of all of this kind of leading up to the surgery.
How long does the fatigue last?
Some people will tell you that they never get really back to their baseline level of energy after something like this. But it's certainly going to be better than it is now. You have to think all those months of the headache you were having, this was
growing.
Yeah. And creating a lot of pressure back there. It's going to take at least that much time to feel better, to improve.
You started Doing it in February.
Yeah, you had like 6 months leading, about 4 to 6 months leading into all of this. So, yeah.
And so when you do the small one, you're gonna get rid of it?
Yeah.
Okay.
Yeah.
So that won't be. And is that in the cerebellum as well?
No,
or-
that's in the frontal lobe on the right-hand side. High right side.
Oh, that's okay.
Yeah, it's not next to anything. It should, and it's so small, honestly, that I think it should be a non-event to treat that one.
And it's cancer.
There's no reason to believe it's anything different. Yeah.
Okay.
We don't have normal things that should look like that.
Okay.
The odds of the radiation working are very, very high. Okay, so we talked about maybe feeling a little tired, maybe having a little bit of a headache. When we treat in the cerebellar area, because your nausea vomiting center is there, sometimes even just a little passing radiation through there can make you feel nauseous. Okay, if that's the case, we can give you medication to help with that. You might have Zofran at home already, an anti-nausea medication that usually helps. Okay. I don't expect you to have tremendous headache, tremendous nausea, or vomiting in the weeks after treatment. Okay, it would be kind of related to the actual treatment you had that day, maybe the next day, but not lingering. One of the rare things that can happen after we give this high dose pinpoint radiation treatment is that you can cause something called necrosis, where it's exuberant death of the tissue in that area. It's almost like an abscess, like you create this pocket of dead tissue there, and your immune system will react to it. You can get chronic swelling in those areas, and swelling can lead to symptoms like headaches, nausea, or vomiting. Okay, you've never seen radiation treatments of the brain. You're not on any medication that would increase the risk of radiation causing that. So I think the risk is probably on the less than 10% number. Okay. I have a form here that lists risks and complications. Two of the other things it says on here are bleeding or seizures. This type of cancer does not typically bleed. There are some cancers that we worry about that in, but breast cancer is not one of them. Seizure, we don't see from the cerebellum or from that back area. It's theoretically possible from this one, but it doesn't, like again, it's very small. There's no swelling around it. It's not creating any symptoms now. So I think the risk of the radiation provoking a seizure from the treatment would be single digits, less than 5%.
So when they did the surgery, he said after the cyanide, the percentage of it coming back is like 0.
It's less than 5%. It's low. I wouldn't say it's 0, but it's low. Yeah.
Okay. So what about the one on the side?
I would give that a very similar number. Yeah. It's very effective. What the old techniques were that we would do something called whole brain radiation, where we gave a lower dose, but we treated everything, and that can cause a lot of cognitive problems, short-term memory issues, things like that. Right. So we're moving away from doing that type of treatment. The downside is that you can develop metastases or these little problems elsewhere in the brain, because the radiation only works where we're directing it. Right. It doesn't touch any of the other stuff, for better or for worse. I'd say, again, 30 to 50% chance that we'll cross this bridge again. What we do is that we do the treatment, and then every 3 months now we do MRI scans for follow-up. So no more surprises. This was the first time that we're going to be surprised by something happening in the brain. Now we know if there's a potential for this to happen, we're going to be more vigilant about looking. Because ideally, if it does happen again, we find it when it looks like that, and we don't have to do surgery, and we just do a single radiation treatment, and you keep moving with your life. Okay?
Yep.
That's the plan.
Alrighty.
All right. So Diane McQueen is my coordinator for the CyberKnife. She does all the logistics of authorization and scheduling. So you walk out, and I'm going to tell her, I need you to authorize treatment. I need you to authorize an MRI for me. She'll start looking at the the insurance and all that, and then she'll call you, usually within 24 to 48 hours. Okay? And then she'll work out a good date and time for you. All right.
Do they measure and put a dot where you should?
I don't put any marks on your skin. Nope. Yeah. You're gonna have the mask. They might put some stickies on the mask for the lasers in the room and all of that, but they won't put any marks on your face. It's not like the breast. I know you probably have tattoos from that and from the lymphoma. Yeah. No.
Yeah, that's my one big one here from the lymphoma.
Oh, yeah. No more tattoos.
Okay. Do you want to introduce yourself?
Dr.
to my
Amalone?